Good morning, everyone. We are going to jump in. Welcome to Public Safety, Transportation, and Environment Subcommittee. It is, what is today? February 6th, Friday, February 6th. Thank you for accommodating us to make things a little bit earlier today. We really appreciate it. I would like to call out the Maryland Insurance Administration, Kelly Norton, as the budget analyst, will go first. Thank you.
Thank you, Chair. We're going to begin with page 1. We have the operating budget summary. The budget for fiscal 2027 increases to $59.3 million, a 3.2% increase compared to fiscal 2026. Turning to page 2, we see Exhibit 1, which gives us an overview of agency spending in fiscal 2027. Personnel accounts for 65% of the budget with $38.7 million. The insurance tracking system project makes up 15% of the fiscal 2027 allowance at $8.7 million. On page 3, Exhibit 2 shows the causes for the changes between fiscal 2027 and 2026. Personnel expenses account for a $3.2 million increase from fiscal 2026 to 2027, with the largest portion being $1.9 million for employee and retiree health insurance. Funding for the insurance tracking system project increased $1 million. Areas of growth were offset by decreases in various consulting needs, such as the $1 million decrease in contracts needed to support annual reports and $700,000 for consultants for actuaries in the life and health unit. Personnel data can be found on page 4. Regular and contractual positions hold steady from the fiscal 2026 working budget to the fiscal 2027 allowance, with a total count of 304.7 positions. It should be noted that the fiscal 2026 allowance budgeted for 287 positions, but 6 were abolished as part of a statewide effort to abolish positions. MIA has had an issue with vacancies in recent years, but Exhibit 3 on page 5 shows that vacancies have continued to decrease. Bless you. Over calendar years 2024-2025, MIA has reduced vacancies from the peak of 56.5 in April 2024 to 13 in July 2025. Exhibit 4 on page 6 shows vacancies by unit for December 2025. Vacancy rates continue to be low across the various units. The units with the most vacancies are the larger units, such as property and casualty with 4 vacancies. Key observations begin on page 7. The first one covers the Insurance Tracking System Major Information Technology Development Project. This project began in fiscal 2021 with one vendor who defaulted on the contract, causing the project to stall. MIA has been working with Salesforce under the state's master contract since calendar 2023. Phase 1 of the project was completed in May 2025, and MIA has moved on to Phase 2, which will include 2 releases, 4A and 4B. The 4A release will be laid to later in fiscal 2026 due to Salesforce not having the built-in document management capability needed by certain units. Exhibit 5 on page 8 demonstrates how the total cost projections continue to grow. During the last session, the total cost of the project was estimated at $18.1 million. The estimate is now between $30 to $40 million. Exhibit 6 on page 9 shows the project's budget. The current working appropriation is $7.7 million and increases $1 million to $8.7 million in fiscal 2027. DLS recommends adopting committee narrative to request that MIA update the committees on the progress of the project as well as actual and estimated project costs. The next key observation is property and insurance complaints beginning on the current page. MIA receives and processes complaints from consumers seeking review of insurance policies for compliance with state insurance laws. Exhibit 7 on page 10 shows the property and casualty complaints received and resolved in 90 days from fiscal 2021 to 2025. The goal is to resolve 90% of these complaints within 90 days. Beginning fiscal 2026, the goal is 80%. In fiscal 2025, over 7,100 complaints were received, and only 44% were resolved within 90 days. This percentage is up from 36% in 2024, but far from the goals of 90% or 80%. MIA should discuss how it plans to increase the rate of resolution to levels closer to its goal. Key observation 3 is the fraud division, which is responsible for investigating complaints relating to alleged insurance fraud committed by insurance companies, insurance producers, or consumers. Exhibit 8 on page 11 shows the fraud cases open and closed within 180 days from fiscal 2017 to fiscal 2025. There has been an overall decline of referrals open for investigation from fiscal 2017 to 2024. Despite this decrease in referrals, the percentage of cases closed within 180 days decreased from 97% to 22%. In fiscal 2025, the percentage of cases closed within 180 days increased to 77%, while cases open increased over the previous fiscal year. MIA should comment on actions that it took to improve the timely closure rate. MIA introduced new Managing for Results, or MFR metrics, in the 2027 submission for fraud cases. Prior to this submission, MIA had a goal of cases should be referred for charges within 180 days, but has decided tiers would allow the agency to allot more time for more complex cases. In Tier 1, the case involves 2 or less suspects, 2 or less victims, and losses of $50,000 or less, and there is no organized crime activity suspected, and the anticipated level of complexity after initial supervisory review is average. Tier 2, the case involves any of the following: 3 to 4 suspects, 3 to 4 victims, losses of $50,000 to $200,000, suspected organized crime activity, or the anticipated level of complexity after initial supervisory review is significantly above average. In Tier 3, the case involves any of the following: 5 or more suspects, 5 or more victims, losses above $200,000, or is identified as highly complex and requiring extensive time and resources after initial supervisory review. Tier 1 cases should be referred for investigation within 180 days, Tier 2 cases within 270 days, and Tier 3 cases within 365 days. Exhibit 9 on page 12 shows MIA's new MFR data for cases investigated and referred for charges by tier. In 2025, 20 Tier 1 cases were opened and referred for charges, and 5 Tier 2 cases were opened and referred for charges within the allotted time. The last key observation discusses the work group on personal private automobile affordability. Chapter 395 of 2025 directed MIA to convene a work group on automobile affordability in the state. The work group released its report in December 2025, and the work group recommended that MIA should periodically report on Maryland's metrics using the Federal Insurance Office's definition of affordability. Studying the feasibility of integrating the system used by officers during traffic stops with the Maryland Vehicle Administration's online insurance verification, allowing officers to identify drivers without insurance. Studying towing and post-towing procedures following accidents on roads other than state highways to identify overcharging insurers. Studying whether changes should be made to Maryland's graduated licensing and traffic safety laws to reduce the frequency of collision and bodily injury claims related to teen drivers and child passengers. Studying the feasibility of a low-cost automobile insurance program for low-income Marylanders. Studying the feasibility of a credit relief program to reduce personal private automobile insurance for low-income Marylanders. Maryland Auto should implement its plan to shorten its policies from 12 to 6 months, and MIA should submit an annual report on the financial performance and underwriting of profitability of insurers. MIA has plans to introduce legislation related to the low-cost automobile insurance and credit relief recommendations during this session. The operating recommendation is found on page 14 and is for committee narrative requesting status reports on the ongoing insurance tracking system project. And that concludes my presentation. Thank you.
Thank you very much, Ms. Norton. Are there any questions? All right. Madam Secretary, please come up. Yes, it's the correct title is Commissioner. I apologize. And with you is Ms. Hatchett?
Yes.
Okay.
Yes.
Welcome.
Thank you, Madam Chair. I answer to Marie as well. So it's great to be here with you all. Let me first say I want to express our thanks and appreciation to all of you, to the Department of Legislative Services and Ms. Norton for thoughtful analysis of our proposed budget. We agree with the DLS recommendations, and I'm going to go over a few more topics that are highlighted in our written testimony. As the DLS analysis notes, we're continuing to work and enhance our technology infrastructure. A core element and frankly a key element of our budget over the past several years, which is our insurance tracking system. So this is a project that's intended to place our legacy enterprise and complaint system to move us away from multiple custom-built, sometimes internally built platforms that don't integrate to get to a more integrated and more functional platform. And the hope and what we've frankly seen so far from our units that have implemented is bringing more automation to our processes, enhancing the security of our data, streamlining our workflows so that we're more efficient in the work that we do, and improving our ability to analyze data and understand our markets and what's happening over time. So we've submitted two detailed reports for the past year. We've also made some key hires that are really important in terms of managing this project. I think when I was with you all a year ago, we talked about our IT director. We've also brought on a dedicated project manager with deep experience in Salesforce, who has been responsible for the day-to-day of that project. And we've also hired a Salesforce developer contractually with the goal of bringing that expertise into our team rather than relying on the MITDP over time. So I want to talk a little bit of the budget, about the budget and the changes, because certainly if I were you, I would wonder about the jumps in those numbers. I want to, first of all, remind you all where we started, which was a procurement that didn't accurately assess the scope of the work that we needed to do and resulted in a failed procurement. And so working with DoIT, prior to my time, the agency decided that a master contract, working through the DoIT master contract with Salesforce was going to be the best route forward and give the agency flexibility over time to implement the changes that we needed. So the jump that you see from projections from a year ago to this year is accounted for with a few things. The first is that that initial number reflected for the FY26 budget books didn't account for an FY25 budget amendment of approximately $4 million. The second thing is that we didn't have an estimate or projected budget for FY27 yet, right? So that brings us up to a little under $30 million. FY27 is really intended to be the end of the work, most of the work on this project. We've handed out, I think, a spreadsheet so that you can see our current projections. And there are projections for FY28 for closeout, which I would characterize from our perspective right now as just an estimate and an outer bound of what we anticipate spending. So I'm happy to talk about that and answer any questions you may have, because obviously it's critical work. So we've also been and continue to meet with DoIT and the Enterprise Program Management Office on this MITDP. We report to them regularly. They sit in on our meetings with the vendor regularly, and certainly we agree with the recommendation about periodic reporting that's in the analysis. I want to talk next then about the importance of that technology, frankly, to the work and improvement of our work over time. So one of the big focuses for FY26 is to replace our complaint system. That's going to be really significant. And I think property and casualty complaints is a great place to talk about how that is going to help improve our work. So really, when I started this job in October 2024, there was a significant backlog in the property and casualty complaints unit that had frankly built over years and over time. And I think writ large, what happened is there weren't a lot of complaints during the COVID-19 pandemic. So resources were moved, and then complaints started going up and the resources did not catch up with the trajectory of complaints, which we have not seen abating, unfortunately, since that time. So we definitely acknowledge that we are not meeting the MFR requirements, but I don't want the takeaway for you all to be that we are not throwing resources addressing processes within this unit, because there's been an extraordinary amount of work done. So I want to highlight that in fiscal year 2025, this unit closed over 8,700 complaints compared with 5,100 in the previous fiscal year. That jump of about 70% was due to increased resources to the unit. It was reorganization of the unit, and then it was also taking a hard look at the processes and how our workers were doing the day-to-day work. And our Deputy Commissioner, Joy Hatchett, has been instrumental in leading that work for us, and has made great progress. But I think, and as I turn to talk about fraud a little bit, the next critical step for this unit is going to be that Salesforce implementation. I think that it's going to improve the efficiency of how our complaints workers are handling these complaints, and really is going to enable us to better address the backlog and get us to where we need to be for our MFRs. So to talk about our fraud division a little bit, which is a success story, I think, and is a unit that has implemented Salesforce. So they've made significant improvement in their MFRs and cases addressed, and that is largely due to a few things. First of all, we have a relatively new Associate Commissioner, Robert Gwynn, who stepped in a few months before I did. He's brought in a lot of fantastic leaders, done reorganization on that team, and then they've also implemented Salesforce early, which has really allowed them to move efficiently and understand their workload better. So I think the fraud division's experience offers a great example of what the rest of the agency will see once these systems are fully implemented. The last thing I want to talk a little bit about is recruitment and retention. Those have been key focuses over the past year. These are areas where, we need highly specialized workers, and we pay state salaries. So it can be tricky to recruit and retain, but we really have had great success in the past year. I think property and casualty continues to be a little bit of a pain point, just given the discrepancy between what we can pay and then the salaries in private industry. And that's an area that we're really trying to look at going forward in terms of understanding where we are and whether there's anything we can do as a state on that. And I just want to end with part of the recruitment and retention efforts is making sure that we're training the workforce of the future, I think both for the industry and for our agency. So in 2025, we reestablished a Workforce and Education Initiative Advisory Committee. We've had representatives from insurance companies, community organizations, colleges, and public school systems meeting quarterly. I think the committee just met last week. And we've also, Senator Rosa Pepp has attended those meetings. And we also did a lot of work to inform the apprenticeship report that we submitted to you all this year, looked at insurance industry apprenticeships as well as related apprenticeships and things like finance and technology and those opportunities. We submitted a report to you all before the end of the year last year, and it's going to be an area that we continue to look at closely to see how, as a state agency, we can be a convener and help to make sure that those efforts are moving forward. So with that, I'll conclude my testimony and happy to answer any questions you have.
Senator Rosa Pepp.
Yeah, I just want to thank you for taking the apprenticeship project really seriously and putting together the work group. And I think it sort of lays out there is real opportunity here.
Yeah.
And you identify in the report the barriers, which are largely lack of awareness.
Yeah.
And as I think you all know, the governor's Raise Act from last year, which put $5 million towards pay per apprentice and $5 million for helping to stand up apprenticeship intermediaries. The pay per apprentice program has now gone live, and folks can apply. The one for intermediaries, I think, will go live within 2 months or so. But I'd hope that you guys would jump on it and get folks both in the carriers and the agents to get active, because now there's money to do it. Ready to go.
Yeah, absolutely. We'll continue to.
That'd be
talk to
great.
you about that.
I appreciate your help. Thanks. Thanks, Madam Chair.
I just have one, I guess, comment, and I do appreciate the analysis having gone through and in your comment on the MITDP sort of real problems at the beginning. And I mean, this is a much larger issue, not just with your agency, but across the board. But I do appreciate that you're finally able to develop and use technology to make everybody's work easier, more efficient and effective. And when do you think sort of like you will be fully up and running?
I think that we will be fully up and running by the end of fiscal year 27 across our agency. So, and for most of our major units sooner than that, we're really pressing forward with the complaints, which is the most significant portion of what we do.
Okay. Good. Thank you. Thank you very much for being here.
All right, thanks so much.
Thank you. We are going to move on now to the Alcohol, Tobacco, and Cannabis Commission, and Yashadara Rai. Welcome. Thank you.
Thank you, Madam Chair, members of the committee. I am Yashadara Rai, and I'll be presenting the fiscal 27 budget analysis for the Alcohol, Tobacco, and Cannabis Commission, or ATCC. The chart on page 1 shows that the fiscal 27 budget for ATCC increases by approximately $315,000, which is a 2.7% increase from fiscal 26. On page 2, Exhibit 1 shows a total of $12 million in ATCC's fiscal 27 allowance. Of this, 79% is budgeted for personnel expenses for 60 regular positions. Exhibit 2 on page 3 details the proposed budget changes. Major driver of allowance change is an increase in personnel expenses for a total of about $510,000. This includes $304,000 in employee and retiree health insurance. This increase is partially offset by a reduction of about $234,000 in contractual services. On page 4, we have the personnel data. There are 60 regular positions and 1 contractual full-time equivalent budgeted in fiscal 27. As of December 31st, 2025, there was 1 vacant position. ATCC notes that this position is now filled. Exhibit 3 on page 5, this addresses ATCC's goal of deterring possession, sale, and transportation of illegal tobacco and alcohol products through inspections. The blue bars show that ATCC inspected about 3,200 retail tobacco establishments in fiscal 25, and surpassing its goal of inspecting at least 15% of the licensed tobacco establishments annually. The red bars show that ATCC inspected about 2,300 licensed alcohol retailers in fiscal 25 and surpasses the goal of inspecting at least 9%. On page 4, in Exhibit 4, the red bars show that the number of confiscated other tobacco products dropped significantly from about 845,000 confiscations in fiscal 24 to about 370,000 confiscations in fiscal 25. Likewise, the blue bars show that the number of confiscated cigarette packs dropped slightly from about 38,000 in fiscal 24 to about 32,000 confiscations in fiscal 25. Exhibit 5 at the top of page 7 shows the total number of alcohol violations and tobacco criminal violations from fiscal 21 to 25. The number of alcohol violations decreased from 40 in fiscal 24 and 19 in fiscal 23 to 23 violations in fiscal 25. The number of tobacco criminal violations dropped from 393 in fiscal 24 to 144 in fiscal 25, and we request ATCC to comment on the reasons for the decreases in alcohol and tobacco criminal violations. The bottom of page 7 and continuing to page 8 discusses the cannabis-related enforcement measures. Chapters 254 and 255 of 2023 and an MOU between ATCC and the Maryland Cannabis Administration require ATCC to carry out inspections of retail businesses selling cannabis products to identify violations of cannabis licensing and registration laws in the state. In fiscal 25, ATCC agents conducted about 2,300 unlicensed cannabis inspections as compared to 156 unlicensed cannabis inspections in fiscal 24, and also conducted 8 compliance inspections targeting underage sales in fiscal 25. As required by committee narrative in the 2025 JCR, ATCC added 2 new performance measures, which are number 1, the number of unlawful tetrahydrocannabinol products seized, which is estimated to be about 115,000 in fiscal 26, and the percentage of unlicensed cannabis inspections resulting in violations being used, which is estimated to be 11% in fiscal 26. These estimates are based on ATCC's restored authority to enforce provisions of Chapters 254 and 255 of 2023 against all unlicensed and illicit retailers by the Appellate Court of Maryland, and ATCC's expanded enforcement powers in accordance with Chapters 57 and 58 of 2025, which include confiscation of sales of intoxicating cannabis products that violates potency, packaging, and labeling requirements, and also issuing citations or other charging document. Actual data for both new performance measures will be available beginning with MFR submission with the fiscal 28 allowance next year. On page 9 is DLS's recommendation to concur with the governor's allowance. Pages 10 through 12 are appendices. This ends my presentation, and I'm happy to answer any questions.
Thank you very much. Any questions? All right, thank you. If we could have come up Executive Director Jeffrey Kelly and whomever you would like to bring with you. Andrew Garrison and Tom Akris.
Thank you, Madam Chair. Appreciate that. Members of the committee, good morning. My name is Jeff Kelly. I'm the Executive Director of the Alcohol, Tobacco, and Cannabis Commission. Probably one of the best jobs in the state, and I'm very fortunate to have it. I'm here to concur with the DLS analysis of our budget request, and also to urge your concurrence with that, and hopefully your allocation or there's appropriation of those funds for us. We try to be very good stewards of the taxpayers' money. You'll see this year we made no new requests for any special projects. Almost our entire budget is going toward our cost of our staff and our rent and our utilities. That's just about all we've asked for this year. And again, happy to say and happy to reinforce that we don't have any vacancies in our agency right now. We want to be a good place to work. We think we have a happy workforce, but we also think we have a very productive workforce. We want to be the go-to resource for anything that you may be interested in, that our industries may be interested in, that the general public may be interested in regarding the alcohol and tobacco industries, and also our work in the illicit market of cannabis. And so to that end, we've continued to build out our website, which we think is one of the very finest websites for any state agency. And I hope if you've had the opportunity, if you haven't had the opportunity, you go to it. It's simply atcc.maryland.gov. Last year, Senator Rosepep looked at it while we were actually in this hearing, and he had some comments about that. It was a good website overall, but that there were a few things like some of the images that weren't coming clear. We think we've got that all cleaned up now, Senator, and so hopefully it's even better still. And we've added to that. We tried to collect a lot of data that we think is useful to the industries and interested people. And we use a variety of platforms to get that information out there, to make the reports that we issue, once we publish them online, to make them interactive so you can get even more out of them than just simply a static reading of them. We've introduced this past year a dashboard on our THC work, which we know the cannabis, the legitimate cannabis industry is very, very interested in. And that dashboard just went live a little over a week ago. It's something that we update every week, so it's almost real-time information and data. And I think what you'll see is prior to July 1, 2025, we took in maybe hundreds of dollars of cannabis product. Largely, that was evidence that we were using to prosecute cases where we could. Since July 1, 2025, and since the passage of some labeling and advertising law that you passed for us this past year that went effective July 1, we've seized over $2.25 million just since July 1 of this product. And we've been able to charge some of these people who are nefariously operating in the illicit cannabis market somewhere in the area of 110 to 120 cases. So we were able to do very little prior to that, and I'll explain why in just a moment. We've been very effective since this new law passed. So our goal is to be as transparent as we can be, to be as accessible as we can be to all people, especially regarding our data, to be accountable to ourselves, and Andrew helps us a lot with that, and he'll explain some of that in just a little bit, and to be valuable, to provide some service, provide service to our customers, which are the industries, who sometimes need a little help to be compliant, not often, but they need a little help, and even more so for us to combat the variety of illegal, unlicensed markets that are out there. I mentioned we try to be good stewards. Last year, you gave us a one-time funding to enhance our licensing system and to develop an online portal. I'm glad to say that we did that last year. We did that within the funds that you provided for us, and that it went live on June 11th, just this past June 11th. And it was almost, it seems like it's been almost a flawless execution and delivery of that. It starts with someone going to Maryland One Stop, which exists, and creating their account, and then completing their paperwork, completing their applications for licenses or permits from us online using our Salesforce program as well. So Salesforce was built out to be a better licensing platform this past year, and then the introduction of Maryland One Stop. So what's happened is, where previous to June 11th, an interested applicant would fill out paperwork, hard copies, would mail it into us. Our licensing crew would look at that stuff. If it was all there, great, they'd continue the work of processing it, which could take weeks and weeks. If it wasn't complete, they send an email or a written notice back to the applicant and say, we need more from you. And that actually would take, in total, a month, maybe longer to get that. Today, depending on what you're asking for, you could need a permit. You might need a permit from us like immediately. You can go online, create your account, fill out your application, make your payment, and receive your permit in some instances within hours. And when it's a license, there's still some elements that make a license a little bit longer. We have to go out and do on-site visits, conduct some interviews and things along those lines. But instead of being months, they're weeks. So we've really dramatically shortened the period of time it takes to get licensed. So does it work? We think so. We get countless emails from people who are using our site saying how wonderful it is to have this. They think it's one of the best sites in the nation. It's especially nice when these national compliance companies, organizations that help people become license holders and permit holders, they kind of walk them through and do the work for them. They're sending us notes saying what they think of our system and how much they enjoy it. One of them just recently gave us their It's Great award. So they give it to an agency each year. It was an image. It wasn't a real award we got, and it's not a national organization, but nonetheless, it felt good to have somebody who does this for a living say, your thing's great, and it's improved our lives dramatically. So we're really thrilled, and that was money you gave us, and that's us trying to be good about how we spend that money and spend it in the right way. I also like to say that we have wonderful in-house talent in a variety of different ways, including Mike Wynn, who's our communications officer, and everything that looks good about what we do that looks good is because Mike's done it for us. So I just wanted to acknowledge that. He's our website guru. He helps us with our THC dashboard, the way it looks, and he also helps us in designing our various reports. Other areas of in-house talent we have is a young fellow who's just about as bright as you can imagine, and I'm so glad we can keep him. And he has a significant background in statistical work. Well, this past year and a half, we started getting complaints from the electronic smoking devices legitimate industry, the licensed industry, and they were saying, hey, Maryland charges a 20% sales tax on these electronic smoking devices, or ESDs, and we're paying it. But we know a lot of our competitors aren't. You walk down the street, I'm losing business. I go in there. This is people telling us this. We go in, we purchase an item. They're either charging us no tax or 6%. I'm charging 20%. I can't keep my customers. They tell me they're going to these people who are cheaper. And we thought, they're complaining, but maybe it's not a real thing. Well, they gave us about 50 locations. We went out and conducted investigations, and sure enough, the majority of them were not charging the appropriate tax. Some were charging none. Some were charging 6%. Some were charging 12%, which was a previous tax rate. Few were charging 20%. There were a couple who were charging 60%, and I don't know why. Not that many, but they were. That is one of the rates. So anyway, we took that and our investigation and we decided to take it on our own to do a report. And that was to, we labeled it the retailer adherence for Maryland tax requirements report. We went out using our statistician on premise, didn't cost us anything extra, a person who knew this, using, we think, a very supported scientific method to conduct survey throughout every jurisdiction using the appropriate number, based on formulas, the appropriate number of locations in each jurisdiction. And out of that, we ended up identifying 371 places we needed to check, wholly random. We did, and out of that, almost 2/3 of them were not charging the appropriate tax. A couple were overcharging at that 60% rate. 1/3 was about right at 20%, and the rest were between none, 6, and 12%. I was astonished by that. So we've taken this information with the granular detail level of where we went, because this was all done, if you will, undercover. We didn't announce ourselves. We didn't want them to know who we were. We went into each place. We found an item that is commonly sold amongst most of them, so we were always buying the same item, just so we compare apples to apples. And anyway, we took this information on which we've done no enforcement action on. We sent it to the comptroller. Just this past week, I met with her and turned all that data over, and she's going to have her compliance team look into this for auditing. So we think there's a big issue there that hopefully we're going to be able to address real soon. But I say that because this is something, somebody had the idea in-house, so let's try and do this and find out about it. And we don't know how helpful it'll be. I do know it's helpful to the industry that is doing it right, and they've been very grateful for our work on that. Also in-house, and again, Mike played a big role in this. This past year, we did a live webinar, a four-series webinar on the alcohol business. We gave one overview of alcohol work generally. We gave one overview of what it means to be a manufacturer in alcohol in Maryland, what it means to be a wholesaler in Maryland, what it means to be a retailer. We used actual licensees. We went out to their sites. We visited them. We interviewed them extensively. And the whole idea was to try and demystify what the alcohol industry is and maybe to generate excitement from people who could be entrepreneurs and want to get involved but don't know how. So we gave them interviews. We showed interviews. It's all on our website currently if anybody wants to watch the recordings of them. But the idea was to have, to expose people who might be interested. How do I break into this? How do I get started if I want to? So that was the point of that. And we have other ideas of things we're going to do in years moving forward. But that was kind of a fun thing to do, and I hope, we'll see. I don't know how many people may have been interested in, how many, if we planted any seeds here with somebody, but we hope we did. And I would just say, so that's a highlight of some of the things from last year. There's more if you need me to give more. I did want to address the question raised by our analyst concerning our reduction in the alcohol and tobacco inspections and enforcement efforts. And I hope this is a simple answer for you. It strikes me immediately. When the Cannabis Reform Act became law, we were given, by the General Assembly, modifying our budget, we were given an additional roughly 14.5 positions to enforce the provisions of the cannabis law, the new cannabis law. That went effective July 1, 2023. As we always do, we seek compliance and education first. So for the first 2 months, our goal was to go out with a lot of information and tell these retailers who are selling this stuff, and there are thousands of them across the state in the illicit market, not the legal market, and tell them, hey, it's illegal, here's the law, refer to this, we're going to be back, and we're going to take enforcement action, but we're giving you a chance to fix yourselves right now. Well, in that period of time while we were doing that, the Maryland Hemp Coalition filed a lawsuit in Washington County and in part asked for an injunction to stop us from taking any enforcement action. And the judge in Washington County granted that injunction. So we were banned from taking enforcement action against any of these businesses that had been operating probably, well, arguably lawfully before July 1, 2023, but we couldn't take any action. But we had all this staff. We didn't have them July 1 because that's when the funding became available. Actually, it didn't become available until October. It took us a while to bring everybody on board. But that first year, from 23 to 24, we brought on board all these new positions. Then once we got them on board and we got them trained, we had all these agents to conduct cannabis inspections, but no cannabis to inspect. We couldn't do any work on it. So we started doing more tobacco and alcohol inspections. I mean, there are roughly 8,500 locations across the state that sell retail alcohol. There are about 6,500, give or take, that sell retail tobacco products. And while we try to do, let's say, a couple thousand each year of those numbers, we did a lot. We did a lot more, clearly, because we had the staff to do it, and we weren't going to have them just sit around and not do anything. Plus, it was a great time to learn how to do this other work because all of our agents are cross-trained. So they can all do alcohol and tobacco and cannabis work. Paid off for us. The reduction came in when two things happened. When you gave us additional authorities last year on that labeling and advertising for THC, which allowed us to go into a shop, and when we see the product and it's clearly illegal now under the new law, immediately we take action. We don't wait months to enforce or lab test. We take it off the shelves that day. That helped us a lot. And then most recently, the Washington County Circuit Court opinion was overturned by the Appellate Court of Maryland, or now the Court of Appeals, the Appellate Court of Maryland. And we're operating fully now. So I hope that explains that difference. So I hope I've answered your question about that. If not, I'm glad to explain more. If you have any other questions, I'm certainly glad to take it. And I'd like to ask Andrew to speak a little bit about our granular budget work, how we get, specifically, I guess, addressing our general fund and reimbursable fund work. So, Andrew.
Thanks, Jeff. I'll be brief. Andrew Garrison, Director of Finance for the Alcohol, Tobacco, and Cannabis Commission. I, of course, want to thank our DLS analysts for the thoughtful consideration of our budget, the committee for hearing us today. I also want to, of course, thank the governor for his allowance and our DBM colleagues for their work in preparing the budget. Another thing I'd be remiss if I didn't note is really the fiscal team that we've developed here at the ATCC. We've put a lot of work into reorganizing and restructuring our budget along with different functions. And that's really important for two reasons. The main one is the reimbursable fund share of our budget, as noted, is supported by the cannabis tax revenues through the MCA's budget. I believe you heard from our MCA colleagues last week. And what that is supposed to be supporting is our work on the THC side. Jeff talked a lot about the THC inspections that we've been doing, the seizures that we've been able to do with the new authorities granted by the General Assembly. And what I would like to highlight and note, and this is in our written as well, is our guys, when they're going into an establishment, either an alcohol or tobacco establishment, about 70% of the time they're looking for a THC product, for unlicensed THC products. We know that a lot of times these products are sharing shelves with other potentially licensed legal products, a tobacco or another tobacco product. Maybe it's a liquor store as well. And they are looking for that unlicensed product as well. We're doing that really frequently. So again, about 70% of the time, they're looking for THC products. Conversely, on our budget on the reimbursable fund share, it's inverted. So we're spending about 70% general funds supported with 30% reimbursable funds. But really, a lot of the times, more often than not, we are looking for those THC products. And the other important piece that I'd like to highlight with the fiscal folks is organizing our budget using some of the tools that are available through DBM into more discrete sub-programs that really reflect along with our staff and the work that they're doing. So across our 4 units, we have our field enforcement folks. Those are the largest share of our staff. We have the administrative functions. We have a legal function. And then we additionally have a licensing function, and we've divided our expenditures on a sub-object and sub-program level across those units to really reflect the work, because as Jeff mentioned, really a lot of what we're funding here is personnel and staff. And so we wanted to have an accurate reflection of that. Hopefully that makes our DLS analyst job easier going forward. And then that is all I wanted to highlight. And with that, I'm happy to take any questions.
Thank you very much. Thank you. Any questions? Senator Solly?
Thank you for all the information. And it's important that we have good actors, but there is bad actors as well. And I'm sorry, I was a little late. I had an important phone call I had to take care of. But we have gas stations and places of services that are serving minors. And it was random. I just got a text and a call about a place where they're doing that. I just want to know how we're making it enforcing that they're not selling to minors, because a business wants to make business, they want to be profitable, but we want them accountable if they're doing it to minors. So how can we, or what are we enforcing to make sure that's not happening?
So first of all, anytime you have any of these, please send them our way. And on our website, we have a very robust and easy to identify tips line, and everybody will stay anonymous. We will make our own case. With underage purchases, we have partnered with, as an example, with Baltimore City Sheriff's Department. We have a memorandum of understanding with them where we will use their underage cadets and whatnot to make these purchases. We do that across the state. I mentioned Baltimore City because we specifically have an MOU with them, and we've done work with them. We've also done work in Ocean City where we use underage police cadets who will go into these locations and make purchases. And what's kind of interesting is we went down there at one point, we made some purchases, we charged some places, and there were some penalties for that. We'd go back again, and this was along the boardwalk specifically. We'd go back again and try to make some of these purchases, and many of the places that were selling it before said, we're not doing that. We understand. When they would tell this to the underage undercover, saying we don't sell, we understand that you can't do that in this state, and we're not doing it, so it's making an impact. So we partner with local law enforcement who has access generally to underage consumers. We don't have our own. We're not set up for that right now, but we use a lot of local law enforcement who does have that, and we partner with them to make sure we're doing it. We don't know where it's happening, and that's what I mean about telling us, giving us those tips, because we're happy to have them bird dog areas for us, and we'll go out and take that action afterward.
No, we'll talk offline, but thank you, I appreciate it, Mr.
Sure, yes, sir.
Thank you. Thank you very much for being here.
Thank you.
Appreciate it. All right, we are going to jump a bit from our agenda because we are waiting for the Acting Secretary of Transportation. So we are going to go to the Maryland Emergency Medical System Operations Fund, MEMSOF, and I'm going to ask Madeline Miller, our analyst, to please come up.
Good morning. My name is Madeline Miller. Today I'll be presenting the DLS budget forecast of the Maryland Emergency Medical System Operations Fund, or MEMSOF. The revenue for this special fund comes primarily from a surcharge on motor vehicle registrations, and its expenditures support different partners of the state's emergency medical services system. As shown in Exhibit 1 on page 3, the fiscal 27 allowance provides a total of $112.9 million to the Maryland State Police Aviation Command, the Maryland Institute for Emergency Medical Services Systems, the Senator William H. Amos Fire, Rescue, and Ambulance Fund, and the Maryland Fire and Rescue Institute. Of the $59.3 million for MSPAC, $5.5 million of the planned expenditure is contingent upon legislation expanding the allowable uses of the special fund. SB 284, or HB 392, is introduced, would allow the MEMSOF to support general operations of MSPAC instead of only its medically oriented functions through fiscal 2029. A similar provision was included in last year's BRFA, Chapter 604 of 2025, but that provision was for fiscal 25 and 26 only. Exhibit 2 on page 4 shows how much was spent by recipient agencies in fiscal 25, as well as what is projected and planned for fiscal 26 and 27. Something that I want to note is that fiscal 25 spending reflects $3.7 million for the R. Adams Cowley Shock Trauma Center, despite the fiscal 26 budget bill, including a deficiency to withdraw that funding due to a new fund source. Since the publication of this document, or of this analysis, DBM reports that the funding was recovered and should be reflected as a deposit in the fiscal 2026 Comptroller's report. Overall, the allowance has expenditures increasing by 2.4% compared with fiscal 26, or $2.6 million. Turning now to page 6, Exhibit 3 shows MEMSOF revenues and expenditures from fiscal 2016 through 2025. Before increasing in fiscal 2025, the motor vehicle surcharge was last increased in fiscal 2014. Following that increase, revenues outpaced expenditure until fiscal 2018. From fiscal 2018 through 2022, expenses were higher than what was being raised, but the fund had an adequate balance to draw down from. During the 2022 to 2024 period, general fund cash infusions, as well as some actions taken to limit spending by the MEMSOF, were required to prevent insolvency. Chapters 717, 718, and 719 of 2024 increased MVA revenues to the fund beginning in fiscal 25 to bring the fund into structural balance. The fund closed fiscal 25 with a balance of approximately $20.8 million. The portion of the annual motor vehicle surcharge that supports the MEMSOF was $14.50, or $29 if collected biennially through 2024. As shown in Exhibit 4 on page 7, this fund source was fairly stable, generating about $71.5 million per year. Because the surcharge and other revenue sources couldn't support the fund's expenditure without general fund infusions, Chapters 717, 718, and 719 increased the surcharge from $17 to $40, with MEMSOF getting $24.50 per registrant instead of $14.50. This resulted in approximately $30.1 million in additional revenue in fiscal 25, though the new funding level may not yet have been reached due to the frequency that customers register vehicles. I'll turn now to the forecast of the fund that estimates revenues and expenditures in future fiscal years. Going slightly out of order, the DLS forecast through fiscal 2032 is in Exhibit 6 on pages 9 and 10. Appendix 3 with the forecast prepared by the Department of Budget and Management is on page 19. Exhibit 5, which summarizes the different assumptions DBM and DLS use, is shown on page 8. Differences in the forecasts stem from when they are prepared, and more significantly, the different assumptions in growth rates for expenditures. The DLS forecast projects that MEMSOF will remain solvent through at least fiscal 2032 with an estimated closing balance of $15 million in that year. Both forecasts use the assumption that MVA registration fee income will bring in $116 million in fiscal 26, approximately $16 million more than in fiscal 25. Though the fiscal note estimated that MEMSOF's special fund revenue would increase by at most $45.6 million compared with its previous level, that was under the conditions that the number of registrants remained constant and that approximately 1/2 of owners who paid their registrations biennially was evenly distributed across 2 years. That distribution was not even, as shown in Exhibit 7 on page 12. Due to changes in consumer behavior from legislation and other MVA changes, there were some disruptions. Between fiscal 22 and 24, approximately 85.4% of customers registered for 2 years and 14.6% chose to pay the registration annually. But as a result of Chapter 717, the MVA was authorized to offer installment payments for the fees in fiscal 2025. The renewal form sent to registrants was also changed to include the 1-year option. And some customers, such as those who manage fleets, also requested a 3-year option, and that was added in fiscal 2025. Fiscal 26 data suggests 65.2% of customers now register for 1 year. Absent other changes, the impact of these behavior shifts should normalize in fiscal 2026. A discussion of the final issue begins on page 13. Both last session and this year, the BRFA includes a provision that temporarily expands the allowable uses of MEMSOF dollars by MSPAC. These actions are designed to provide temporary relief to the general fund. Language in the fiscal 27 operating bill sets this spending at $5.5 million, which is the amount DBM and DLS assume will also be used in fiscal 28 and 2029. If the BRFA provision was rejected, the fund would receive additional interest income, and the DLS forecast projects a fiscal 2032 closing balance of $33.7 million instead of $15 million. General fund costs associated with the MEMSOF recipients could be permanently reduced rather than temporarily if the funding split that MSPAC receives were altered. Since fiscal 2003, MSPAC's budget has been 80% MEMSOF and 20% general funds based on the ratio of medically oriented functions to non-medical ones. MSPAC reports its operational activities by calendar year through the Managing for Results process. The most recent year in which medically oriented functions made up less than 80% of MSPAC activities was calendar 2014, and the most recent year in which that share was less than 90% was calendar 2021. Exhibit 8 on page 14 shows estimated MSPAC spending in fiscal 27 through 29 if an 85% or 90% special fund ratio were assumed in the DLS DBM forecasts instead of the 80%. The current BRFA provision would provide the general fund with $16.5 million in relief between fiscal 27 and 29. Changing the ratio to 85% would offer less general fund relief in the next 3 budgets at approximately $10.7 million, but altering the ratio to 90% would provide greater general fund relief. In its testimony today, the EMS Board and MSPAC should comment on the feasibility of altering the 80% funding ratio in fiscal 27 and future fiscal years to more accurately reflect the share of medically oriented missions. That concludes my presentation, and I'm happy to take any questions at this time.
Thank you. Are there any questions? All right. Thank you. I'd like to call up Clay Stamp, Chairman of MEMSOF, and whomever else you'd like to bring.
Musical chairs.
Good morning. My name is Bill Ferona. I'm an emergency medicine physician and state EMS board member, filling in for Clay Stamp. I'll be giving the overview this morning of our group. On behalf of the state EMS board, thank you for the opportunity to discuss the status of the Maryland Emergency Medicine System Operations Fund, or MEMSOF. I also want to thank Madeline of the Department of Legislative Services for her comprehensive analysis of the MEMSOF and its future. Maryland's EMS system is a coordinated statewide network that includes 29 jurisdictional EMS operational programs, volunteer and career EMS clinicians, medical and nursing personnel, hospital emergency departments, trauma and specialty care centers, and communication systems. It has been recognized as a national model for emergency medical care. The State Emergency Medical Services Board, whose members are appointed by the governor, oversees the statewide EMS system and reviews and approves the budgets of some of the entities supported by the MEMSOF. For over 30 years, the MEMSOF has provided support for critical components of our statewide EMS system to include MIMS, the Maryland State Police Aviation Command's Medevac program, Maryland Fire and Rescue Institute, R. Adams Cowley Shock Trauma Center, and AMOS fund grants that provides monies to local jurisdictions for the purchase of fire and rescue equipment and capital building improvements. As mentioned, the MEMSOF is primarily funded by a motor vehicle registration fee surcharge. A lesser amount of funding is derived from fines related to moving violations. In 2024, the General Assembly passed crucial legislation that increased the motor vehicle registration surcharge. Subsequently, a looming and potentially disastrous structural deficit in the MEMSOF was averted. It also provided additional support for the R. Adams Cowley Shock Trauma Center, the Maryland Trauma Physician Services Fund, and the Senator Amos Fund grants. You will hear from our partners today how vital that funding is to their day-to-day operations. The State EMS Board remains focused on the health of the MEMSOF. Although recent projections based on analyses by DBM and DLS indicate funds solvency through 2033, we are cognizant that such projections are not sensitive to less than forecasted revenue or unplanned expenditures. We are aware, for example, that tens of thousands of Marylanders each year avoid registering their vehicles in the state. Parenthetically, we are supportive of legislative efforts to address that matter. Further contemplation of additional support from the MEMSOF for Maryland State Police Aviation Command should, as prerequisites, include at least two things: verification of mission profiles and expenses to ensure appropriate categorization, and two, acknowledgement that such support will accelerate depletion and insolvency of the MEMSOF to occur within the next few years, necessitating another round of fee raising if the funding source remains as is. In the meantime, the EMS Board is attentive to the budgets of our partners, especially the portions derived from the MEMSOF. As we continue our never-ending pursuit of excellence, the EMS Board is incredibly grateful for the leadership of the Governor and General Assembly to ensure the vitality of the MEMSOF. The EMS Board and our partners are thankful for your ongoing support of Maryland's EMS system. Thank you.
Spell your last name for me, please.
Sure. F as in Frank, R-O-H-N-A.
Good morning for the next 30 seconds, I think. I'm Dr. Ted Delbridge. I'm the Executive Director of MEMS, the Maryland Institute for Emergency Medical Services Systems, which is a state agency that coordinates all components of the statewide EMS system. It does so by providing medical oversight, promulgating statewide clinical protocols, licensing and certifying EMS clinicians, operating a statewide communication system, designating trauma and specialty centers, and licensing and regulating commercial ambulance services, just to name a few things. The MEMSOF provides support for MEMS and initiatives that benefit our entire statewide EMS system. We are grateful for the efforts of the General Assembly to ensure the ongoing viability of the fund, and especially for legislation passed in 2024 that averted an impending fund solvency problem. I'd like to acknowledge the work of Madeline Miller and thank her for her comprehensive and thoughtful analysis. The heart of the Maryland EMS system is its 20,000 EMS clinicians, emergency medical responders, emergency medical technicians, cardiac rescue technicians, and paramedics who last year answered more than 1 million calls for help and transported safely more than 586,000 people to Maryland hospital emergency departments. During the past year, MEMS certified more than 1,800 new emergency medical technicians and licensed more than 290 paramedics. EMS clinicians treat the patients in need of life-saving emergency care using clinical protocols designed by MEMS. They communicate with physicians at emergency departments and trauma centers using a communication system that's maintained by MEMS. They take patients to emergency departments and hospital specialty centers designated by MEMS to include pediatric and adult trauma centers, stroke centers, cardiac intervention centers, perinatal referral centers, a hand trauma center, an eye specialty center, and 2 burn centers. MEMS continues to work closely to monitor EMS to emergency department transfer times, or the time that it takes for a hospital emergency department to accept responsibility of care for patients being brought to it by the emergency medical services system. We communicate weekly with emergency department hospital leadership, and we transmit data monthly to the Health Services Cost Review Commission as part of its efforts to encourage hospitals to engage in quality improvement efforts. During the past year, MEMS developed and deployed the Emergency Department Advisory System, a web-based platform that provides real-time indication of the busyness of emergency departments to try to help to level set arrivals to the emergency department from the EMS system. We understand that it's being used on a daily basis by the EMS system in hospitals and have had nothing but positive feedback. We also support efforts to provide emergency care before the EMS system arrives. With support from the Maryland Office of Overdose Response, we're working toward an October 2027 target to co-locate naloxone with automated external defibrillators throughout the state, in particular certain public places. There are currently more than 17,000 AEDs registered in the MEMS public AED registry, and more than 1,380 are co-located with naloxone. And these are just a few of the examples of how the MSOF supports MEMS and our efforts to improve on a daily basis the emergency medical services system, which benefits the entirety of the state. Thanks.
Thank you.
Good afternoon, Madam Chair, members of the committee. My name is Michael Cox. I'm the Executive Director of the Maryland Fire and Rescue Institute at the University of Maryland. This Maryland Fire Rescue Institute is responsible, or is actually the state's comprehensive training and education system for all of our emergency responders here in the state, both career and volunteer. This year, we trained more than 28,000 students to be first responders here in the state. That really totals up to somewhere around the neighborhood of 3,700 classes, 850,000 student hours that were employed during this process. As you hear from my partners, and I just want to echo this, we have the finest EMS system in the nation. In my position as a state fire training director, I get to frequently talk with and collaborate with other folks around the country, and there's no other state that has an EMS system like ours. It is really the best. And it can't be done without the collaborative effort that you see of all of our folks sitting here at the table. There are some really smart people that put this system together back in the 1970s, and it has lasted for all these years with no problem. So in closing, I don't want to take much more of your time, but I do want to say that we really appreciate the support we've received from everyone over the past few years to be able to provide the citizens of Maryland such a great system. Thank you.
Thank you.
Good afternoon, Chair, members of the committee. Thank you for the opportunity to testify before you today. My name is Major Michael Tagliaferri. I'm the commander of the Maryland State Police Aviation Command, and I represent Colonel Michael Jackson of the Maryland State Police. For 55 years, the Maryland State Police Aviation Command has served as Maryland's premier provider of state airborne public safety services, operating 24 hours a day from 7 strategically located bases. Our 10 AW-139 helicopters and fixed-wing aircraft support emergency medical response, law enforcement, search and rescue, disaster assessment, and homeland security. In 2025 alone, MSPAC crews completed nearly 2,900 missions, including almost 2,000 scene medevacs that transported more than 2,000 critically injured patients. A nationally recognized basing model allows us to reach at least 95% of Maryland within 25 minutes, ensuring life-saving care reaches each patient when seconds truly matter. Maryland Trauma System was recently highlighted in an EMS One article that underscored how our integrated approach saved lives. On January 12, 2026, following a major commercial motor vehicle crash on Interstate 95 in Howard County, Maryland System brought the hospital to the highway. That response included multiple fire and EMS agencies, 3 MSPAC helicopters, 14 units of whole blood, and a shock trauma go team flown directly to the scene, demonstrating how Maryland is redefining field medicine with hospital-grade intervention delivered on scene. As the article noted, Maryland's EMS and helicopter medevac system is one of the finest in the nation and truly serves as a model for others to follow. The strength of our system lies in seamless integration of fire, EMS, aviation, and trauma teams working as one with one shared goal, getting the patient to the right place at the right time. Our 180 sworn and civilian professionals maximize every dollar entrusted to us through efficient in-house maintenance, advanced training, life-saving innovations such as our statewide whole blood program, which has already saved hundreds of lives without waste. Since inception, we have administered 364 units of whole blood to 279 patients. In 2025, several significant projects further advanced MSPAC's capabilities, including the establishment of Maryland's first non-hospital, non-airport-based FAA-approved instrument flight rules landing zone in Ocean City, located at Northside Park. This capability ensures safe aircraft access during poor visibility or adverse coastal weather, maintaining uninterrupted emergency medical transport. MSPAC also became the first civilian aviation medical program in the nation to deploy and test the Battlefield Assisted Trauma Distribution Observation Kit, or BATDOC, developed by the Air Force Research Laboratory. This system enhances real-time patient monitoring, streamlines medical documentation, and improves the transfer of critical patient information to receiving trauma centers. We're grateful for the General Assembly's leadership in stabilizing MSOFT and respectfully request continued fiscal year 27 funding to sustain critical life-saving mission for the citizens of Maryland. In regards to the request for comment, the provisions in the BRFA bill of 2026 would allow MSBAC to offset up to $5.5 million in general fund expenses. This does not mean that those expenses are not medically oriented. MSBAC's 2025 operations have been calculated to be over 95% medically oriented. The current funding structure for MSP is 80% MEMSOFT funding and 20% general funding. Any offsetting in expenses would be predominantly related to the medically oriented services provided by MSPAC. MSPAC strives to be the best steward of all funds. It is appropriated to fulfill the life-saving mission. All expenses are vetted to ensure only mission-critical expenses are incurred. As such, MSPAC will continue to work with the board and DBM as it relates to determining the most efficient percentage splitting of funds for MSPAC. Thank you for your time.
Thank you very much. Any questions? I just want to say, I mean, I say it often, but how fortunate we are to live in Maryland, and we are with regard to all of your service. So thank you. I travel all around the world and have the opportunity to just know how fortunate we are here to have this system in place at every level and know that our people are safe and we are safe, and hopefully we never need your services, but it is reassuring to so many of us that you are there if we do. So thank you.
Thank you. Thank you for your support.
Thank you. I'm going to push you a little bit on the last comment, and as a follow-up, just would like to have a further conversation about changing this formula.
Sure.
Okay. Thank you. Thank you very much.
Thank you.
Thank you.
All right, we have now the Maryland Department of Transportation overview, and welcome Samuel Quist.
Thank you. Good afternoon. This is the DLS overview of the Maryland Department of Transportation. I'm going to begin on page 2 of the report. This is an overview of the budget. In fiscal 2027, operating and capital totals just over $7 billion, which is an increase of $326.1 million or 4.8%. You can see on page 2, the budget includes about $5.4 billion in special funds from the Transportation Trust Fund and $1.6 billion in federal funds. The discussion of the Transportation Trust Fund begins on page 4. Exhibit 1 shows the fiscal 2025 TTF closeout. At the end of fiscal 25, the balance was $327 million, which was approximately $73 million lower than the $400 million closing balance 1 year ago. Revenues were about $68 million lower than projected, and expenditures were a net $5 million higher, accounting for that difference. On the bottom of page 5, there's a note about fiscal 2026 year-to-date revenue attainment. Revenues from the TTF's three largest state revenue sources, motor fuel taxes, titling taxes, and vehicle registration fees, were approximately $154.6 million higher than projections. DLS projects that if this revenue attainment continues at this pace, fiscal 26 would close out approximately $398 million higher than projections. On page 7, Exhibit 2, this shows a summary of the revenues of the Transportation Trust Fund in the 6-year financial plan released by the department in January. The largest fund sources for the TTF include federal capital funding at about $8.6 billion or 19%, titling tax revenue at $8.1 billion or 18%, motor fuel taxes at $7.9 billion or 18%, and vehicle registration fees at just under $4 billion or 9%. Combined, those four sources make up about 2/3 of overall TTF revenues, and then there's a variety of other revenue sources also shown on the chart that make up the remainder of those. On pages 8 and 9, Exhibit 3 is the summary of the TTF forecast released by MDOT in January. The forecast includes projections for the opening and closing fund balance, revenue sources, expenditures, debt outstanding and debt service coverage ratios, as well as a summary of the capital program. The 6-year forecast shows the projections for 2026 through 2031, as well as the actuals for fiscal 2025. And in the preceding pages of the report, we'll get into some more of these numbers in detail. Moving on to capital briefly, on page 10, the 6-year consolidated transportation program released by the department in January totals about $22.6 billion. By fund, shown in Exhibit 4, about 39% comes from federal funding, 31% comes from special funding, about 15% from consolidated transportation bond proceeds, and then the remainder includes general fund transfers. The majority of these are general funds for the Washington Metropolitan Area Transit Authority capital support. There is funding from grant anticipation revenue vehicle bonds, and then a variety of other miscellaneous categories there. Exhibit 5 on page 11 shows a comparison of the consolidated transportation program over the 5 years that overlap between the January 26 plan and the January 2025 plan. In total, the increase is about $1.4 billion in capital spending. Broken down by mode, the biggest increase is under the State Highway Administration. There's about $943 million in increased spending there. And by fund, the majority of the increase is increased federal funds at about a $1 billion increase. On page 12, Exhibit 6 is showing the 6-year CTP by investment category. The largest category of spending is system preservation projects at about $8.2 billion or 44%, followed by expansion and efficiency projects about 20%. And then on page 13, Exhibit 7, this is showing a total capital spending by year from fiscal 2012 through 2031 projected. You can see that in prior years there's been some fluctuation. However, the past couple of years there's generally been an increase. In fiscal 2025, capital spending exceeded $3 billion for the first time, and it is projected to peak in fiscal 2028 at approximately $3.7 billion. Turning to page 14, the next section of the analysis now moves to discussing the fiscal 27 budget allowance. Exhibit 8 is showing the uses of Transportation Trust Fund in the 27 budget, which total about $7.2 billion. In addition to the roughly $7 billion that go towards the MDOT budget, there is also about $100 million that go to deductions to other state agencies in the budget. Within MDOT, the operating budget is about $3.3 billion, or 46%. The statewide capital program is about 40%, or $2.9 billion. And then state aid, highway user revenue, capital grants are another 6%, or $438 million. And then the final piece is the debt service on consolidated transportation bonds, which is about $453 million, or 6%. Exhibit 9 on page 15 and continuing on to page 16 gives a breakdown of the budget data for the fiscal 25 actuals, the 26 working appropriation, and the 27 allowance. The first section for the operating budget, as I mentioned previously, the operating budget totals just under $3.3 billion, which is an increase of about $172.8 million. Broken down by mode, the largest area of increase is the Maryland Transit Administration budget, which grows by about $71.4 million, followed by the State Highway Administration, which grows by about $36.9 million, and the Secretary's Office, which grows by about $31.6 million. Then in the middle of the chart on page 15, there's debt service and highway user revenues are broken out. Debt service grows by about $33.7 million. Highway user revenue grants remain roughly equal to fiscal 26 levels, growing by about $211,000. And then the capital program grows by about $119.3 million, with the largest increases in the capital budget in fiscal 27 in the Maryland Transit Administration at about $126 million increase. On the bottom of page 16 and continuing on page 17, there is a summary of fiscal 26 deficiency appropriations that are included in the fiscal 27 budget bill. In total, these are $26.7 million, all special funds from the TTF for these. On page 18 begins discussion of the fiscal 27 operating budget for MDOT. Exhibit 10 is showing the breakdown across the different MDOT modes. You can see here in this pie chart that the largest portion of the MDOT operating budget is the Maryland Transit Administration at just under $1.4 billion, or 42% of the total. The second largest is funding to support WMATA at just under $700 million, or 22%. And considering these two categories together, transit spending as a whole is roughly 2/3 of the total operating budget. Then Exhibit 11 on page 19 shows a summary of personnel. There's a net increase of 147 positions in the fiscal 27 allowance, and the main changes are, you can see under the Secretary's Office, there's an increase of 184 positions. This is mainly due to interdepartmental transfers from the other MDOT modes as part of a realignment of IT positions, and you can see that there's corresponding decreases in some of the other modes. The largest main area of new positions is under the Maryland Transit Administration. MTA has a net increase of 104 positions. However, in total, there are about 139 new positions, and then there are about 32 transfers out of MTA for that IT consolidation. The majority of new positions under MTA, about 134, are new MTA police positions, which are related to the Purple Line to increase staffing there in anticipation of the opening of the Purple Line in fiscal 2028. And then there are also about 5 new positions in MTA for the MTA apprenticeship program. And then there are 8 new positions in the State Highway Administration that are also added as well. On page 20, there's some discussion of some other miscellaneous position changes that occurred in fiscal 26 and are accounted for under the fiscal 26 working appropriation totals. So first, in the 2026 budget bill, 44 positions were transferred from the Maryland Transportation Authority to the MDOT Secretary's Office as part of that IT consolidation. Next, there were 37 positions that were transferred out of MDOT in fiscal 26 as part of the establishment of the new Department of Social and Economic Mobility. And then in fiscal 26, there were approximately 26 positions abolished by the Board of Public Works as part of the voluntary separation program, and another 12 positions that were vacant that were also abolished by the Board of Public Works in October. Exhibit 12 on page 21, we're now moving on to discussion of highway user revenue grants. This chart is showing the breakdown between Baltimore City, the counties, and municipalities. As I mentioned earlier, highway user revenue grants remain roughly similar in fiscal 27 compared to 26 based on the funding formula there. In total, the change is an increase of about $200,000. So $100,000 of that goes to Baltimore City and $100,000 goes to the other counties in Maryland. And then turning to page 22, we have some more discussion of the fiscal 27 capital budget. So Exhibit 13 is showing a breakdown by MDOT mode. Within the capital budget, the largest portion goes to the State Highway Administration, about $1.2 billion or 31%, and then followed by the Maryland Transit Administration at just under $1 billion or 25%. There is a note on the top of page 3 about contingent language in the SHA capital program. The fiscal 27 budget bill includes $10 million from the Strategic Energy Investment Fund for SHA, and there is contingent language attached to that appropriation. There is a provision in the Budget Reconciliation and Financing Act which would authorize the use of strategic energy investment funds for that purpose under SHA. Exhibit 14 on page 24 is showing a breakdown of first year capital funding within the 26 working appropriation and 27 allowance by mode. Within the individual MDOT modal budget analyses, we will provide a breakdown of the individual projects within the different modes that account for this funding. The summary is shown here in the overview. And then the last chart for capital, Exhibit 15 on the bottom of page 25 and continuing on page 26, is showing the other funds that are included in the capital program. Other funds are not non-federal funds and non-special funds from the TTF that largely fall outside of the Transportation Trust Fund. For example, on the bottom of page 25, you can see passenger and customer facility charges from BWI Airport, which fund projects at the Maryland Aviation Administration. And then on page 26 and page 27, there are some other miscellaneous fund sources. There are some local funding, funding from other private parties, funding from GEO bond funds from WMATA, and then some other fund sources there. The issues section of the analysis begins on page 28. The first item covered is discussing new and increased Transportation Trust Fund revenues that were enacted by the General Assembly in the 24 and 25 sessions. On page 29, Exhibit 16 is a table summarizing those and showing the projections for the revenues by MDOT and the financial forecast. So in total, across all the revenue increases enacted in the 24 and 25 session, it's estimated that those will raise an additional approximately $4.9 billion through fiscal 2031. This averages out to roughly $800 million annually between fiscal 26 and 2031. On pages 31 and 32, there's a breakdown of what each of those revenue increases are, and discussing those. And then on page 32, Exhibit 17, there's a chart that's attempting to show how some of these increases are utilized. Exhibit 17 is comparing the January 26 MDOT TTF forecast to the January 24 MDOT TTF forecast, which was put out before any of these revenue increases were enacted, and showing some of the major changes in revenues and expenditures. So the first two blue bars on the left-hand side of the chart show the $4.9 billion in increased revenues. In addition to that, there are $1.2 billion in increased consolidated transportation bond proceeds. This is somewhat related to those revenue increases as through increasing the TTF revenues, MDOT's debt capacity and ability to issue additional debt is raised. So the January 26 forecast reflects additional debt increases. Then looking at the orange bars, starting at the right-hand side of the chart, the largest increase in expenditures. There's about $3.1 billion in increased operating expenditures due to growth in revenue, due to growth in operating expenses across MDOT. Then there's $1.3 billion in increased capital spending from the TTF. There is about $645 million in decreased revenues related to lower fund balance that those revenue increases offset. And there are also $600 million in motor fuel tax projected declines that those new revenues offset. And then the final piece is about $294 million in increased expenditures for debt service costs. Then turning to page 33, the second issue that's discussed in the analysis are recent Office of Legislative Audit findings related to federal fund attainment within MDOT. The Office of Legislative Audits issued a fiscal compliance audit of the State Highway Administration in September 25, and then a statewide report on closeout transactions for fiscal 2025. Every December, OLA issues a statewide review of closeout transactions for the fiscal year that just recently concluded. And in that report, OLA issued findings raising concern over unsupported federal fund revenue entries by SHA and MTA, and it also raised findings of federal fund expenditures for federal grants that were not explicitly outlined in the federal grant agreement. So as follow-up on page 34, in the bold language there, the analysis is asking MDOT to provide an update to the committees on the actual amount of federal funds that it has collected from the federal government related to reported accrued revenues from the close of fiscal 2025 through fiscal 26 through to date, and the status of approval of funds that OLA found that were not authorized. MDOT should also discuss its progress on implementing corrective actions that were recommended by OLA in its audit findings in both of those reports. The last item in the overview, the Department of Legislative Services recommended actions. There is one recommendation in the overview analysis that DLS includes each year. This is budget bill language that DLS recommends, requiring the department to submit a report to the budget committees if there are any major changes to capital projects in the Consolidated Transportation Program. That concludes the DLS overview analysis. Thank you.
Thank you very much. Any questions for Mr. Quist? All right, thank you. Madam Acting Secretary, come on up, please. Acting Secretary Catherine Thompson, welcome.
Good afternoon, Chair Hedelman and members of the committee. I am joined by Deputy Secretary Samantha Biddle. It's a pleasure to be with you this afternoon to discuss the department and the look ahead. I started my role last month, and since then I've been privileged to experience the inner workings of the department and meet with many members of the General Assembly, including some of you. In my first few days on the job, we celebrated the Maryland Transit Administration's first new Metro subway cars entering service for the first time in more than 40 years. We also joined the governor to celebrate BWI Thurgood Marshall Airport's opening its largest capital project in the airport's history, the new Concourse AB connector and the baggage handling system. I've also witnessed the full force of MDOT's dedicated workers quickly clean snow and ice off the roads, transit stations, runways, and the port to get Maryland open and moving again. And I'm so pleased and thankful for my team and others across the state who worked throughout the storm. We had not a single fatality, not a single serious injury, and not a single serious accident during the height of the storm. In my short time here, I've also been able to dive into the department's capital and operating budgets, as well as its funding sources. The expert leadership within the department and across all of our modes has helped bring me up to speed. It's a great honor to work with such an amazing and dedicated team. Turning now to an overview of the department, MDOT's mission remains the same: delivering a safe, reliable, and efficient transportation system that is also affordable, accessible, and resilient. We look forward to working with you and the entire General Assembly to build on MDOT's strong foundation to further enhance safety, improve operational excellence, modernize the department, and strengthen our workforce pipeline. Together, we can help deliver measurable results that Marylanders feel and experience in their communities and that position Maryland to win the future. The department's final consolidated transportation program for fiscal years 2026 to 2031 strategically invests $22.1 billion to advance our shared priorities. This was all possible thanks to Governor Moore's budget and the General Assembly's support in securing more than $400 million in additional annual transportation funding during the last legislative session. So thank you so much for your support. These dollars helped stabilize the budget and ensured that no federal dollars were left on the table. The final CTP includes the department's core commitments with full funding for projects along I-81, US 15, I-97 in Anne Arundel County, MD 97 in Montgomery Hills, and MD 5 in Great Mills. These new capital projects are tied to safety, partnership, and maintenance while also helping us grow the economy. We're also continuing our commitment to advance SHA's Pedestrian Safety Action Plan and complete streets quick build demonstration pilots along high incident corridors. SHA is making great progress on safety enhancements along Route 1, including ongoing projects at Dr. Patel Drive and Rowanberry Drive, which are expected to be completed later this spring. The final CTP also includes more than $540 million in pedestrian and bicyclist projects, marking the largest investment ever from MDOT for these types of projects. Of this funding, nearly $234 million is dedicated to construction. Combined, these active transportation projects create safer communities where people want to live, work, and build Maryland's economy. MTA's light rail modernization plan is moving forward now as well and is on the market with requests for proposals. The whole line, from new modern low-floor vehicles to upgrades at all light rail stations, systems, and maintenance facilities, will be modernized. This is the first significant investment in the state's light rail system in 30 years. Meanwhile, BWI Marshall is completing its Southwest maintenance facility, and work is underway to replace Martin State Airport's World War II air traffic control tower. CSX's Howard Street Tunnel project will soon wrap up and will position the Port of Baltimore for a brighter business future. Once complete, the project will allow for double-stacked rail cargo in and out of the port all along the eastern seaboard and out to Midwest markets. The project created thousands of quality jobs and will ultimately grow the Port of Baltimore even more. We're also moving forward to rehabilitate the port's Dundalk Marine Terminal Berth 11. Because of the challenges Maryland's Transportation Trust Fund faces, even with meaningful investments, MDOT is constrained as to what we can take on. Our focus at MDOT is to balance maintaining our system with growth and transformation. As a multimodal agency, we must take a balanced approach to solving Maryland's mobility challenges. That being said, I look forward to working with all of you and your continued partnership. Now I'd like to turn to the DLS analysis. First, I'd like to thank our DLS analyst, Sam Quist, for his work on the analysis. He shows a solid understanding of some of the key issues that the department is facing right now. We've prepared written responses that you hopefully already have, but I'd like to hit on a couple of key responses. We were asked to comment on the recent OLA audit regarding federal fund receivables. MDOT respectfully does not agree with OLA's findings, but we take them seriously. Federal grants are a critical funding source for MDOT's capital program. Approximately 1/2 of the current 6-year capital fund is funded through federal funds. MDOT works diligently to ensure that as we advance our projects, we do so in accordance with all federal rules so that we may seek full federal reimbursement of projects at the appropriate time. Both the Federal Highway Administration and Federal Transit Administration have programs that allow state departments of transportation to access federal funds early to better align with multi-year project cash flows. This provides the state with significant flexibility to advance more projects simultaneously and to maximize the use of available obligation authority. Since 2020, MDOT has expanded the categories and phases of projects that it uses federal funds on. During that same time, US DOT also changed certain rules regarding federal aid reimbursement. Together, these two actions significantly increase the number of actions that require federal approvals during a project's lifecycle. Unfortunately, staffing levels at SHA did not keep up with this increase in workload, which led to delays in seeking federal reimbursement. In addition, over the last several years, we've seen an increase in federal government shutdowns and the number of continuing resolutions needed to fund federal operations. These too have disrupted MDOT's recovery of federal funds. The department's fiscal year 2027 operating budget takes direct aim at remediating these issues going forward. We're requesting 8 new positions at SHA to help address this issue, and also additional, we'll also be putting in place additional systems, documenting standard procedures, improving business processes, and modernizing IT systems to ensure that we stay on top of seeking federal reimbursement on a timely basis. The DLS analysis included 1 recommended action requiring notification of changes to the capital program, and we concur with that recommendation. That concludes my remarks, and we'd be happy to take questions.
Thank you very much. Senator Selling.
Speaking on the the actions that we're asking you to follow up on the MDOT, but you should comment on these federal funds to the State Highway Administration and the Maryland Transportation Administration, which could not provide the documents, and you were stating that, you know, I'm sure there's some conflict there between your federal, of us as administration and the federal department that we're trying to get returns or get a refund. Is there something more that we need to look into, or we need to find ways so we can, I know it's difficult, but if there's other ways or methods that we can work with and make a difference in this, is there something more that we can do?
Thank you for your question. First, I want to stress that there is no noncompliance with federal law, no noncompliance with any law. What these are is sort of, I would describe, and I don't want to minimize it, housekeeping problems that we need to hire more people to be able to process the increase in federal funds that we're seeking. And we need to have better systems and processes in place to enable the timely processing. The Federal Highway Administration and the Federal Transit Administration have been supportive of our work. We have every reason to believe that we will be reimbursed for all eligible expenses that we submit, but we do need on an ongoing basis to do more things to stay on top of it in real time. And we are happy to provide updates on a regular basis to assure you that we are doing the work that we need to do. And you have my commitment that we'll stay on top of it.
I am getting the updates from SHA with the bridge, just to let you know. I get them weekly. We've had briefings, and they were in detail. And I want to thank them for that first and foremost. And I just believe, you know, always making sure that we have transparency is one of the best things we can have as our department, this administration, with transportation. And I think it's really important. And just speaking on some of the things that I just want to mention of some of the complaints that everybody's hearing about. The fees increase. The registration fee, of course, gone up. The electrical surcharge was something that was held back. The certification of title fees. The emission fees was something that I believe somebody's trying to do a bill to look into. And the increase fees for those for historic tags, because now you go back so many years and those have to re-register and you get those funds. Just want to say, with that and with the tire tax, we're getting a lot of complaints, of course we all are, because people are just looking at this and thinking that, you know, why are we doing this? And I understand we're trying to work on ways to recover as a state. And taxing and feeing people doesn't benefit us in the long run, because then they see it's a burden, they leave. And I just see that myself. But I just think at the same time, if we do tax and we fee people, I think we need to find a way where we can give them better understanding of why we're doing it. Because just doing it doesn't benefit me when I try to explain that in detail. And I just want to mention that if I could, because I know you do. I know you just got here, and I'm not trying to burden you down, but these are just some of the complaints that we do have with these types of actions that have taken place through legislation. If some of them have doubled. I'll give you an example. The emissions fees doubled, Mathican more than doubled. And people are complaining about that, and they're just trying their best to be in compliance and do the right things. And so that's just one thing. I got just one more question if I could, Madam Chair. One thing that we see with the motor fuel tax decline, I know that we depend on that. But can you maybe explain, is there more EVs out there that probably, that's maybe one of the reasons why it's declining? Or is there something else we need to look at that we're not getting those funds we used to get? Because we know what we use that for.
Thank you for all of your comments. For the motor vehicle gas tax, I think there are two principal drivers. One is cars tend to be much more fuel efficient than they used to be. And then secondarily, there are more EVs on the road. And to your general point about increased fees and taxes, we share your concern about the burden that it places on Marylanders. We are also mindful of the challenges across the board, funding programs across the state of Maryland, including transportation, and we are happy to work with the General Assembly to look at all viable options moving forward that allow us to continue to invest in the transportation system while mitigating the burden to the extent we can on the taxpayers.
Well, I appreciate that. Thank you. Thank you, Madam Chair.
Thank you. Senator Rosepap.
Two things. One, I wanted to continue the discussion about the undocumented federal reimbursements. I think I understand it, but I'm not sure I understand it. In the normal course of events, how is the system supposed to work? Maybe just sort of summarize that.
Sure. The way it works is, and this is true of federal funding generally, you have to incur the cost, do the work, and then you're entitled to seek reimbursement through federal funds. So the federal funds are available for you, but you can't tap into them until you have actually expended your own funds, and you have to seek reimbursement.
Okay.
Does that make sense?
Yes, but.
Okay.
But do you get the commitment for them before we spend the funds? Or is it like, well, they might reimburse us, or they might not reimburse us?
It is a commitment, but again, the way it is structured.
You don't get the cash.
You don't get the cash. You get.
But you have a documented commitment from the federal agency that if you do this and it costs this, we will give you this much money?
You know in advance what you're allocated, what we call them is formula funds.
Okay.
You know in advance, each state knows in advance
Right.
what its allocated formula funds will be
Right.
in a given fiscal year. And you are entitled to tap into those funds, but only after you've incurred the cost. And then you have to also demonstrate that they are eligible for recovery. And it's a well-established process. So we do the work. We know how much we have to spend from federal government. We do the work. We submit the funds. We make the justification as to why it's eligible, and then we obtain reimbursement.
Okay. So what is it that you weren't doing that's the problem?
Over the past 6 years or so, we have relied more heavily on federal funding, which means we're trying not to leave any available federal dollars on the table. And so we have been using more federal funds to cover statewide projects. And so the volume of requests for reimbursement has increased dramatically. And we're behind on seeking, doing the timely request for reimbursement.
Okay. But, so it means before 6 years, there was more federal money that we were not requesting reimbursement for?
If I could add maybe a clarifying point. Previously, the use of federal dollars on a state highway project might have been for 5 projects all totaling $50 million each. We are now utilizing, and that would have been for the construction phase of a project. We are now utilizing federal funds for additional phases of work on more projects as well. So whereas we would have had larger tranches of pull downs constituting fewer federal actions, we are now utilizing federal funds on more of the planning phases, the design phases of a project. So we will have, where we would have previously had 5 federal actions, we may now have 50 federal actions.
But leading to us getting more money.
We are getting more money, but it is not a larger sum of money. We are pulling it down in sometimes in smaller quantities, smaller tranches, which results in more federal action, so more administrative work, more administration.
So same amount of money, but pulling it down in smaller bites.
Yes.
That's the essence of it?
That's the essence of it, yes.
And that produces more paperwork, which you guys got behind on.
Correct.
That's the essence of the issue.
That's the essence of it.
But the total amount of money is known because it's a formula.
Correct.
And that amount has increased over time, but that amount is not related to the backlog and reimbursements.
I understand. Okay, thank you. Now I think I understand. Second question, separate from that issue. Last year, when Secretary Wiedefeld was here, it was like a week or two after the Trump administration had said they were taking back all kinds of money for transportation, and he told us that they then had backed off and all that sort of stuff. Big picture with transportation, what kind of shape are we in with the Trump administration? Key Bridge I kind of know about, but separate from Key Bridge, are they messing with us again?
I think and believe we have a pretty strong relationship with the U.S. Department of Transportation. You know, the politics and the atmospherics aside, a great relationship on a daily basis with federal highways, the Federal Transit Administration, and we are continuing to be able to tap into funds that we expected to be able to tap into, like the formula funding for highways. There are certain types of programs like funding for new major transit projects that the federal government is not investing in transit as much as the prior administration did. So the likelihood that we would be able to tap into that for significant new transit projects, it would be a steep hill to climb. But for the most part, thankfully, we're business as usual with US DOT.
Is it endangering any current projects?
Not to my knowledge, no.
Okay, all right, thank you. Thank you, Madam Chair.
Any other questions? Okay.
Thank
Well,
you
appreciate the conversations that we've had, and I'm sure we will continue as we go into each of your modes budget hearings as well.
Thank you.
Thank you. All right, that concludes that hearing. Now we have MDOT debt service requirements. Can't go too far.
I was going to say, we'll just stay here if that's okay with you.
Yes, of course. Thank you.
All right, thank you. The MDOT debt service requirements analysis covers the debt service payments on consolidated transportation bonds, which are 15-year bonds issued by the department to support its capital program. And these are tax-supported debts. The analysis also discusses a couple of other types of debt utilized by the department, including grant anticipation revenue vehicle bonds and other non-traditional debt sources. The chart on page 1 of the analysis shows the fiscal 27 debt service is $452.9 million, which is an increase of $33.7 million or 8%. On the top of page 2, there is discussion of one proposed deficiency appropriation in the budget bill for fiscal 26. This is a negative deficiency, which reduces the appropriation for fiscal 26 by $8.2 million to reflect lower actual debt service payments required for the fiscal year than what was anticipated during session last year. This savings was attained due to refunding of some previously issued debt that occurred as part of the most recent bond sale in October of 2025, as well as lower initial debt service payments on new debt issued for fiscal 25 and 26 than what was initially anticipated. Pages 2 through 4 of the analysis go on to discuss the three main criteria in statute and in the bond resolutions that govern the issuance of CTB debt. These include a debt outstanding limit as well as 2 debt service coverage ratios. Starting out with discussion of the debt outstanding limit, statute currently currently limits the amount of CTBs outstanding to $5 billion. This was increased last session from $4.5 billion by the Budget Reconciliation and Financing Act. Additionally, the General Assembly also has authority in the budget bill each year to set a debt outstanding limit for the fiscal year. Then the two debt service coverage ratios, these require that the maximum, that the annual net income and pledged taxes from the prior year be equal to at least 2.0 times the maximum level of future debt service payments. Furthermore, the department has a management practice that requires a minimum coverage ratio of 2.5 times the maximum future debt service. Based on the current MDOT financial forecast, it is projected that MDOT will maintain these debt service coverage ratios at an adequate level throughout all years of the forecast period. However, in fiscal 2031, the final year of the forecast period, the net income debt service ratio does decline to the 2.5 times level, which is equal to the MDOT administrative threshold. On page 4, Exhibit 1, this shows a summary of the debt issuances, debt service, and debt outstanding by fiscal year from fiscal 2017 through the 2031 forecast. You can see that there's been some fluctuation recently in fiscal 23 and 24. There were new bonds issued in those years. There were no new bonds issued in those years, which resulted in a downward trend of the debt outstanding. In fiscal 25, there were $200 million in new bonds issued. In fiscal 26, there have been $345 million in new bonds issued. And in fiscal 27, it's projected that there will be $785 million in new bonds issued, and that results in an increase in the projected debt outstanding, which grows to just under $4 billion at the end of the forecast period in 2031. You can see that the $785 million in new debt issuances in fiscal 27 is relatively large in comparison to the amount issued in recent fiscal years. However, as stated previously, MDOT does maintain compliance with its debt service coverage ratios and has adequate debt service capacity for those increased issuances. On page 5 of the analysis, there is discussion of grant anticipation revenue bonds, or GARVI bonds. These are transportation bonds that are issued by states and public authorities that are paid back using future federal highway and transit formula funding. Basically, the idea behind GARVI bonds is that they allow increased funding available for the capital program in the short term at the expense of obligating future federal funding that will be available in future years for capital expenditures. The state has used GARVI bonds once in the past for the Intercounty Connector project, and in current statute there are limits in state statute for the use of GARVI bonds. State statutes limits them to maturities of up to 15 years and that they may not exceed $1 billion at the end of fiscal years. And there is a specific list of allowable projects that is says what projects that they can be used for. Most recently, the Budget Reconciliation and Financing Act last year added the rehabilitation of the MTA light rail system in the Baltimore area as an allowable use of GARVI bonds. The 2026 Consolidated Transportation Program includes a financing plan for the light rail modernization program, which includes $643 million out of the total project cost of approximately $1.4 billion to be funded through GARVI bonds. MDOT anticipates that the first issuance of Garvey bonds of $275 million would occur in fiscal 2027, followed by a subsequent issuance of $368 million in fiscal 2031. Then the next few pages of the analysis go on to discuss non-traditional debt issued by the department and paid back by debt service. Non-traditional debt is defined as any other debt other than the consolidated transportation bonds or Garvey bonds. Some examples of non-traditional debt include certificates of participation, debts that are repaid using passenger and facility charges and other revenues. And then there are also two sources of indirect debt that held by the Purple Line P3 concessionaire that are paid back through availability payments on the Purple Line. So Exhibit 2 on pages 6 through 9 of the analysis outlines each of those individual non-traditional debt items. So there are 8 individual items that there are debt service payments on during fiscal 27. There are 9 individual non-traditional debt items that will have payments on in fiscal 27. Of those, 8 will be outstanding at the end of the fiscal year, as well as 1 additional pending issuance. And then there are the 2 indirect AP non-traditional debt items related to the Purple Line. In total, the principal outstanding on the non-traditional debt direct amounts is $819.2 million. The fiscal 27 debt service payments is approximately $86.9 million. Lastly, on pages 10 and 11 are the 2 DLS recommended actions. These are 2 annual budget bill language items that DLS recommends each year. The first is setting a debt outstanding limit for consolidated transportation bonds, non-traditional debt, and Purple Line debt in the budget bill for fiscal 2027, and outlining a process by which MDOT may increase that debt above those limits through providing notification to the budget committees. And then the second recommendation is requesting 2 reports on non-traditional debt to be submitted with the September and January financial forecasts. And that concludes the DLS analysis.
Thank you very much, Sam. Are there any questions? All right.
Thank you again for the opportunity to testify this afternoon. For the record, I'm Katie Thompson, Acting Secretary of Transportation, and I'm joined by Deputy Secretary Samantha Biddle. Again, we'd like to thank Sam Quist for his work to prepare the budget analysis. As I'm stepping into this role, it's helpful to get these analyses and prepare for the budget hearings to help me get quickly up to speed on the department's recent activities. MDOT has a long history of strong financial management, as evidenced by its credit ratings of AAA from S&P, AA1 from Moody's, and AA+ from Fitch. As Mr. Quist noted, MDOT sold bonds twice this year. In June, we sold $200 million of consolidated transportation bonds at a true interest cost of 3.81%. And in October, we hit the market again with the sale of $345 million in bonds at a true interest cost of 3.43%. At the October sale, we also took the opportunity to refinance $500 million of outstanding bonds. Since these bonds will be outstanding for a shorter period of time than the new bonds, we were able to secure lower interest rates of 2.47%. This refinancing provides $18 million in debt service savings over the remaining 7-year life of the bonds. Turning to the DLS analysis, DLS recommended 2 pieces of annual budget bill language, and MDOT concurs with both. This concludes my remarks. We'd be happy to answer any questions.
I don't think we have any questions. All right. Thank you very much.
Thank you very much. Have a great
Appreciate
afternoon.
it. You too.